Okay, so let's move on to questions 5, please. Questions 5. Okay, thanks.
Thank you. This question is from Susan from Highland Visually Impaired Community Forum. And I think it's a good question from disabled people across all the rural and island communities in Scotland. Susan says, people in the Highlands already face geographic barriers and long waiting lists. What will your party do to ensure that disabled people in remote and rural locations are not doubly disadvantaged by the lack of access to things like healthcare, transport and rehabilitation support services?
If I can start with Karen and work our way down.
Okay. Well, speaking as a Highlander, I was born in Inverness. I lived my teenage years in Wick, so I'm well aware of the distances involved. At the moment, I spend a lot of time in Skye. So I know the challenges in getting, in getting from A to B in those rural parts, and they have not been well served. I know that my colleagues in the Highlands are really fighting for decent services for Caithness General Hospital, for maternity provision there, for example. But I think it's just really important that people are able to have the services that they need close by. And that really requires health boards to make sure that they provide things in people's own communities so that they don't have to travel for a couple of 100 miles on a regular basis just to access, for example, rehab support. They need to do so much more to and that again needs the funding to ensure that the facilities are available locally.
Yeah, geographical barriers are an enormous issue, particularly around healthcare, when so many of our tertiary and quaternary services are based in the central belt and getting people here. So transplant medicine, for example, the service I'm most familiar with. So there are lots of things we can do, and Scottish Labour are committed to looking at ways in which we take digital technologies and use them to address some of these barriers. So during the pandemic, we really ramped up the amount of near-me appointments that were being done because a lot of healthcare can be effectively delivered virtually, either by phone or online, in a way that is acceptable to patients. And all of the research we've done has shown that it's acceptable to patients. In fact, it's most acceptable to patients in lower socioeconomic groups because it fits much better around their care responsibilities, their life, their work, being able to do things remotely. The risk there is that we need to ensure that we're tackling digital exclusion alongside the geographical barriers to care, because in some reports up to 8 or 9% of the Scottish population do not have reliable access to internet, and so you can't move things online. Down south, they're getting some of this right because they're doing it through the NHS app. We do not have the NHS app up here. It's designed and built in Glasgow, but we're not using it. That is something that we will look at. I was at a roundtable recently looking at technology options, because these are things that can break down those barriers. It has all sorts of benefits to people. Equally, an issue that we have in those communities is not them getting out for care, but it's getting care in. We want to shift to the community, in line with the recommendations of the Darcy report. We want to shift care into the community. We want care to be delivered in the community. And Scottish Labour are committed to a living wage of £15 an hour for care workers. Even that is not enough to afford to live in some of our remote communities where second homes have driven up house prices. So we need to find ways to allow carers to live in the communities, and then care can be delivered in those communities. So people don't have to travel out to get the care because it can be delivered close by. And at the moment, we are pricing people, and we're pricing the people who do those jobs out of those communities. That's something that Scottish Labour are determined to tackle.
Mike.
Thanks. I'll pick up where Oliver left off. I think that there's a real importance to look at what rural communities are and what has not been provided. And I think affordable housing is a key issue. And it's not only affordable housing, but it's affordable, accessible housing supply. So we want to introduce a new universal Scottish accessible home standard. This builds on the work we did with the Housing Act that was passed last year, making sure that in every residential development, a specific number, a minimum number of homes will meet certain specs for facilities like accessible wet rooms, hoists, those kinds of things, those adaptations already as part of how they are built and designed. So that's the thing about the accessibility of the homes, but if we are looking at the sustainability of our communities, we need affordable homes for everyone, and that is one of the reasons why the Scottish Greens have worked so hard on changing the housing market, because the housing market doesn't work for the vast majority of people. We need to be focused on building more affordable homes, but we also need to be focused on bringing empty homes into use. So so nurses and doctors, consultants can live and work there. We know, so I represent the North East region, which includes Angus and Aberdeenshire, two rural local authorities. We know NHS Grampian has several positions vacant, not because people don't want to do the work, but because people can't afford to live where those jobs are. And so we have to look at the whole community, the whole community view, and see how things connect, see how healthcare provision connects with transport, connects with housing, connects with other facilities. We also need to make sure that there are community facilities in and accessible to communities that either have an accessible transport route or don't require, long travel distances. And I think that always comes down to investment and political choices. But again, it's a plea to make sure your voices are heard and to make sure that local authorities, when they are talking about local development plans, have your voices heard in the mix, so they don't design things that are way out of town, way out of the villages that nobody can get to. We know that when we design equality into our systems, everybody benefits, and that's exactly what the Scottish Greens want to do, whether it's across health and social care or transport or housing, as I've already spoken about. My final point on this is, again, we know that particularly in rural communities, Highland communities, and island communities most especially, legal aid doesn't exist because there are no legal aid providers. So one of the things that the Scottish Greens are committed to is a reform of the legal aid system, so we know there will be legal aid solicitors in areas like Highlands and Islands where that service at the moment doesn't exist because all of the available solicitors are in the Central Belt, and even those are few and far between. So we need to absolutely be looking at the systems, looking at communities and asking ourselves, what do they need? And therefore, what do we need to provide? What do we need to provide differently to make them inclusive and accessible?
Thanks, Maggie. Just to say we're a bit tight for time on this, but Daniel?
Yeah, obviously I'll be really clear. I mean, I think what's been said so far is really important. I think we need to make sure we're attracting the workforce, the health and social care workforce to rural communities. I think we need to utilize tech and AI, which is going to overcome many of the barriers that we face. And also providing, that local support, that local funding, specifically to rural councils, to make sure that they can provide adequate care. But I think it comes back to making sure that the interventions that are provided to rural communities are right for the rural communities. And I think we need to have that discussion directly.
Okay, I'll take one small question or point, if that's okay.
Hi, I was just wondering a question for not just this question, it links to all of them that you've just answered, from question 1 all the way down to question 6, if we get there. The main one for me is your manifestos, when you get them and when we get them, are you actually going to stick to them, or are you just going to ignore them? I'm really confused to why you've got a manifesto and you don't actually stick to them. It's confusing for me, and not just me. I think all the 32 local councils that we've got in Scotland, we all need to stick together, and if you say you're going to do something, actually do it.
Okay.
Thank you.
We were all nice up to that point as well. Yeah, we'll come back to that point. I'm going to take Pauline quickly.
I'll try and be quick, thank you. So the National Care Service promised a consistent service across Scotland, wherever you lived, and failed to get through as it was in the Parliament. And we know that that question asked about health and social care support. So on the one hand, you've got health and we can have all these digital services and everything. But in social care support, you have things like 10-minute appointments for people when they have high support needs. You also have people accessing our wonderful self-directed support, but when they go for option one, and self-directed support is all about choice and control, but when they go for option one, they're told they can't have option one because there are no PAs, personal assistants, in that area, and that happens most in rural areas, and then people end up either on option 3 or going into care homes, young disabled people often. What do your parties think about those things for remote rural areas? Thank you.
Daniel?
Absolutely. Just to respond to that manifesto question, I would say yes. Absolutely, we'll stick. I think we need to maintain trust in politics, and I think when politicians don't stick to what they promise, that trust is lost. So I think this is, the simple answer is yes. Obviously, things do come up, but that would be my answer to that. And to your question, I think this comes down to encouraging choice and options, and whether you are in a rural community or whether you're in an urban area, you should have access to that choice, and you shouldn't have, your health and social care needs not necessarily met because of that. So I think it's really, really important that we have equality in that sense between urban and rural areas.
Can I come in?
Karen?
Yeah, I think one of the things that's really hampered the provision, social care workers is the fact that the national insurance charge did not exempt social care workers, so that's really kind of put an additional cost into the system, that there just wasn't the funding to deal with. But one of the things that we would do as well is that we would allow local authorities to designate housing for key workers, and those decisions would be made on a local basis depending on what that community needed. So that would also help with perhaps getting more workers to where they needed to be.
Well,
yeah, so Scottish Labour are committed to introducing a national care service on par with an NHS. It's too long been a Cinderella service, and we need to remove those geographical variations. We need to remove inequity of access, and we do that by ensuring the highest standards of social care and making those jobs incredibly well paid and well supported and very attractive jobs all across the country to remove that geographical variation. Absolutely. And I think that is something that we have been promised. We have been promised a lot of money has been spent trying to do it, and it got watered down and abandoned. Scottish Labour are committed to it. It's in our manifesto, or it will be in our manifesto when it comes out. Manifestos, I think, if I'm being completely honest with you, I think, personally, if you are expecting people not to be willing to change their minds in the face of new information over the course of 5 years, then you're asking to be lied to. The manifesto are the things that we want to do and that we will do. And the UK government down south is delivering on manifesto commitments every single week and has been for the last 2 years. But sometimes situations change, and I think we would all recognise that there are things out with the control of any government. And so there needs to be some recognition that sometimes when you get new information, the best thing to do is to change your mind sometimes. When you hear better voices and when you hear better ideas, then you change your mind. So I think The fundamental underpinning goals and ideals and values of a manifesto should always be respected and stuck to, and I think they always are. Sometimes the exact means to those ends may need to change in light of changing events.
Mike.
Thanks. I think I'll come to the manifesto question first. I think Greens are standing on a manifesto. It's not published yet, but when it is, we're standing on that manifesto, and we will seek to implement as much of it as we can. We are also realistic that we won't be we're very unlikely to be the largest party, although, you know, please do vote Green. I'm not going to discourage that. But I think, look at what we've achieved. In the last 5 years, we ran on a manifesto in 2021 saying we would deliver a new deal for tenants. We've delivered rent controls and significant changes to the housing market that are going to make it make things much easier and cheaper for people to live. We said we'd bring the costs of transport down. We've delivered free bus travel for under 22s, and we want to expand that. We've also we've abolished the costs of school meals. We've expanded free school meals, and we've written off a lot of public sector debt. We said we would change the benefit system. One of the things we've been able to do is mitigate the benefits cap. You know, these are tangible things that were in our manifesto that we have delivered. So you know, we will use whatever influence we have in the next session to continue to do that. On your question about care, I think care is one of the things that we as human beings are good at. We are good at caring for each other. We are good at creating things with each other, and we are good at collective work, at working together and sharing with each other. And yet our economy doesn't value that at all. We want to change that, and there's several ways of doing that. Yes, we want to pay care workers properly, and the £15 an hour is the absolute minimum that care workers should be paid. But we also want everybody to have a decent income so that they can live, and that's why our party policy remains in support of a universal basic income. We won't get there in one step. Minimum income guarantee is one of the steps that we want to use, and we want that implemented as much as possible. But we have to have person-centred care in our services design too.
Thanks, Maggie.